Hi, my name is Mackenzie. I'm 25 years old. I'm a labor and delivery nurse, and I started training at 5x3 actually exactly about a year ago. I always wanted to train because my boyfriend was super into weightlifting and my sister was really into weightlifting, and I was a runner and they were really trying to convince me to weightlift. So I ran a marathon in February of last year, and I decided after the marathon it would be a good time to stop running and get into weightlifting. But then also I really wanted to get into weightlifting because I have a history of really bad back pain. So that started when I was younger. I was a gymnast and I pulled on my back. I fell off a balance beam when I was like, I don't know, younger than 10. And ever since then I've pulled on my back about once a year. And I've gotten chiropractic work, I've gotten physical therapy, you know, of course you go to an urgent care, they put you on medications, all that stuff. And it worked up until that point, but then after the marathon, of course, I pulled at my back and it just didn't get better. As I mentioned, I'm a labor and delivery nurse, so of course 12-hour shifts and I'm at the hospital, and when you're a labor and delivery nurse, it's a lot of lifting of patients, moving patients around. So I was calling out of work, and I had just started, this was my first nursing job, so it's like obviously something really needed to change. Of course I went to an orthopedic doctor, they told me surgery, they told me to get the shots. I did some research and I had seen before that strength training was supposed to be really helpful for your back, but anybody who's had this type of back pain or any type of rehab type pain, they go to the doctor and that's the last thing they tell you to do. Obviously, it's like deadlift, no, you're insane. Don't deadlift, don't squat, don't do any of that stuff. But I mean, I'm 25 years old, so surgery just doesn't seem like an option, especially with surgery. They're telling you, okay, so once you get surgery, your life is totally changed after that. You can't do certain things, and I figured I didn't want to go down that route just yet. I mean, like, what do you have to lose? Your article about how you had helped a veteran here who had a messed up back, and you guys just got him deadlifting and got him to the point where he was able to get back into strength training. So I saw that article, I got super excited because I'm in Baltimore, obviously, and so I reached out to you and I started strength training. Choosing weightlifting as a type of rehab as opposed to a medical path for it, you realize it's not a 100% fix, which, well, most things aren't a 100% fix anyways, but you realize it's not a 100% fix. You will have bad days, but with learning how to train, you learn how to cope with those bad days as well. The bad days become less scary, whereas before, if you had a bad day, you were hopeless. You didn't know how to fix it. There was no plan in place, so you didn't know if it was going to get better. Whereas for now, that's another thing that helps having a coach. When I have a bad day, I know it's not the end of the world. I've dealt with this before and I've fixed it before. Not only is it like a physical strength thing where you know you have the physical capability of dealing with this pain, you also realize how much of this pain is mental as well. Like how much of your awareness is the adrenaline going, or like how much you're just worried about hurting yourself more. But when you have the confidence of knowing you've got the coach there telling you your form is okay, you have the coach there helping you with programming. It's good to have a coach when, especially with weight training, you get really passionate about it. You get really excited about it. So you can either get really cocky about your weights. So yeah, you're worried, you start going up in weights, you probably shouldn't be going, your form starts to break down, but of course you can do it. Or you get really, your confidence goes down for whatever reason. You're too scared to go up on your weights, maybe you should. It really doesn't feel like exercise. It just does not feel like exercise. There's never a point where I don't want to come to the gym, because it is about feeling healthier and it is about wanting to be a better person and everything, but it's also just like, let me see how much I can lift today. Let me see how much I can move today, and you're excited about it. As a young woman, I mean, a young woman in exercise, it's a big thing for us, that type of like body image, calorie in, calorie out type mindset, when you're just stuck in this idea that, you want to be as small as possible. And like whether you talk about like an actual disordered eating, when you get in that mindset, you never feel like you're going to get out of it, ever. It's like, it just becomes a part of your life. You can't even imagine thinking any other way, and it's crazy. Weightlifting is it's like a cheat. It's like a mechanical way of fixing disordered eating. If you get into weightlifting, you can't help but be fixed from that, because it flips a switch in your mind. it associates eating more food with positivity. So it's just a good thing. So it's crazy. If you had asked me 2 years ago, it's like, do you think you'll ever not care about eating? Like, no, it's just always going to be a part of my life, and I can eat whatever I want now. You know, it's amazing. Like, you would tell a young woman that it's like you could eat anything you want in the world, and it'll just be fine. It'll be a good thing, and that's what it's done. So I absolutely, like, that was a side thing, but I absolutely love it for that reason. It's just been a huge positive thing in my life, and also I just feel better about myself. I feel better about my body. I feel healthier. Being confident in the gym has translated to confidence at work. It was a moment for me a few weeks ago where I walked into the gym and I had set up my stuff on the bench and I'd walked away to get something at the Y. I was at the Y, not here. And I had set up my stuff on the bench and walked away to get something, and then I came back and a guy was at the bench. He had taken the bench that I was working on, and the gym was pretty packed. Like, there was it's a small weight room, so there was a lot of people, so everybody could hear my interaction, but I was like, no, like, that's my bench. I'm in the right. I know lifting etiquette at this point, and I'm confident with what I know to say something. So I told him, I was like, oh no, I had my stuff set up here and everything, and he's like, oh, okay, and he walked away. But like, a few other people were like laughing a little bit, and I was like, no, it doesn't matter. No, I would not have done that before. Absolutely not. It's like, hey, I gotta get my reps in, you know. But yeah, so it's been really nice, like, learning all the skills here to then be able to translate somewhere else, and also, after everything I've learned here, being pretty confident that at those gyms I actually am the one who knows the most in those areas. So